Question number 27 is, which of the following are the poor prognostic indicators in glomerular diseases? First is female sex. No, it is the male sex which is the poor prognostic indicator. Hypertension, yes. Persistent and severe proteinuria, yes. Elevated creatinine level at the presentation, yes. So answer will be 2, 3 and 4 only. So 1 is wrong. Answer will be C, 2, 3 and 4 only. So what are the poor prognostic indicators in the glomerular disease? So first is the male sex. So in comparison to female, males are at increases. Males tend to have worse renal outcome in many glomerular disease. Second is the hypertension. High BP further damages glomeruli and accelerates kidney deterioration. So if there is a patient who is having kidney glomerular disease and the patient is also having hypertension, he is in the poor prognostic indicator. Third is persistent and severe proteinuria. So if there is ongoing loss of large amount of protein in urine, it indicates that there is a continued glomerular damage. So proteinuria more than 3.5 gram per day, poor prognosis. Then elevated creatinine at the time of presentation. So at the time of presentation, when the patient presented to you, the serum creatinine level was high, it indicates poor prognosis. It means it reflected that there was reduced kidney function from the very starting. Then there was a rapid rate of decline in renal function. If the GFR worsening is becoming very fast, it is very fast, then it indicates aggressive disease course. So steep decline means poor prognosis. Then tubulointerstitial fibrosis on the renal biopsy. So you went for the renal biopsy, and the renal biopsy you saw there was tubulointerstitial fibrosis. It indicates there is chronic damage and scarring of kidney tissue associated with the poor reversibility. So this is the normal kidney, and in the case of tubulointerstitial fibrosis, you saw that it's a worse prognosis. So these are the indicators. One is the male sex, poor prognostic indicator. Hypertension, poor prognosis. Persistent and severe proteinuria, poor prognosis. Elevated creatinine level at the time of presentation, poor prognosis. Rapid rate of decline in the renal function, poor prognosis. And tubulointerstitial fibrosis on the renal biopsy, it indicates poor prognosis. So not just the glomeruli, but even if there is tubulointerstitial fibrosis, it indicates it's the. So question number 28, which of the following are indications for the renal biopsy? So in which of the following conditions you are going to go for renal biopsy? So first is chronic kidney disease of uncertain etiology. Yes, not only chronic kidney disease, but even acute kidney disease of uncertain etiology, you are going to go for the renal biopsy. So first is correct. Second is nephritic syndrome. Yes, you are going to go for renal biopsy to make the diagnosis. Third is uncontrolled severe hypertension. No, this is contraindication. This is contraindication of renal biopsy. So if there is uncontrolled severe hypertension, you are not going to go for renal biopsy. Fourth is renal transplant dysfunction. Yes, the patient underwent renal transplant and now there is some problem. So you are going to go for the renal biopsy so as to see if there is rejection or not. So 1, 2 and 4. So answer will be 1, 2 and 4. B will be correct option, not the third is wrong, because uncontrolled severe hypertension is contraindication, not the indication of renal biopsy. So let us look at the what are indications in which you are going to go for the renal biopsy. First is acute kidney injury and chronic kidney disease of uncertain etiology. Second is nephrotic syndrome or glomerular proteinuria, means protein is to creatinine ratio more than 100 milligram per mole. In case of adults, you are going to go for the renal biopsy. So either it's nephrotic syndrome or glomerular proteinuria. Third is nephrotic syndrome in children that has atypical features or is not responding to treatment. So if it's the nephrotic syndrome in children, so generally in the nephrotic syndrome in the children is your minimal change disease. So in that case, you are not going to go for the renal biopsy. But there's a nephrotic syndrome in the children that is presenting with atypical feature and is not responding to your treatment. Then you are going to go for the renal biopsy to look at the cause. Then nephritic syndrome. So in all cases of nephritic syndrome, you are going to go for the renal biopsy. Then renal transplant dysfunction. So the patient underwent renal transplant, but now there are some problems occurring. So you want to see if the kidney rejection has occurred or not. So that for that case, you are going to go for renal transplant renal biopsy. Rarely performed for isolated hematuria or isolated low-grade proteinuria in the absence of impaired renal function or evidence of multi-system disorder. So if there is isolated hematuria or there is isolated low-grade proteinuria, you are not going to go for the renal biopsy. But if it is present with the impaired renal function or there is evidence of multisystem disorder, then you can go for the renal biopsy. So these are some indications. That is, you do not know the etiology, either it's acute kidney injury or chronic kidney disease. It's a nephrotic syndrome in adults. It's nephrotic syndrome in children who are not presenting with a treatment or are presenting with the atypical features. In nephrotic syndrome, in all cases, you are going to go for it. Renal transplant dysfunction, you are going to go for it. And if isolated hematuria, isolated low-grade proteinuria is present with other features like impaired renal function or evidence of multisystem disorder, you are going to go for it, not in the isolated cases. In isolated cases, you are not going to go for renal biopsy. Okay. Now, what are the contraindications in which you are not going to go for renal biopsy? So if the coagulation is disordered or there is thrombocytopenia, if platelet count is low, you will not go for renal biopsy. Aspirin or other antiplatelet agents increase the bleeding risk. That's why you are not going to go for it. Second, uncontrolled hypertension. The option in that question was about it only. Uncontrolled hypertension, you are not going to go for the renal biopsy. If the kidney size is less than 60% of predicted size, do not go. If the kidney is solitary, there is single kidney, except the transplant patients that we have seen that we have to go for the renal biopsy. So if there is solitary kidney, you are not going to go for it, but it's a relative contraindication. It's not a complete contraindication. What can be complications of the renal biopsy? There can be pain, but it's usually mild. There can be bleeding into urine, usually minor, but may produce clot, colic, and obstruction. Bleeding around the kidney, occasionally massive and requiring angiography with intervention or surgery. Sometimes it may be required. Or there can become arteriovenous fistula, which is rarely significant clinically. So this is about the renal biopsy. Now coming to question number 29, which of the following is the correct range of glomerular filtration rate for stage 2 of the chronic kidney disease? So there is a patient who is having chronic kidney disease and he is in the stage 2. So what will be the GFR? 60 to 89, 45 to 59, 30 to 44, 15 to 29. So it's A, 60 to 89 milliliter per minute, 1.73 meter square body surface area. So we are going to see what are the stages of chronic kidney disease. So there are 5 stages: 1, 2, 3A, 3B, 4 and 5. So in the 3 there are 2 parts, 3A and 3B. But what is kidney disease for? Kidney damage for. So kidney damage means abnormalities of kidney structure or function present for more than 3 months with implications for health. So that is kidney damage. Now this kidney damage may be there, but GFR may be normal or may be high. So it is possible that GFR is normal, GFR is high, but kidney damage is present. Means what is kidney damage? There is abnormalities in the kidney structure and kidney function. So stage 1 means that there is kidney damage, but GFR is normal or high. When will you say it's normal or high? It means it is more than 90. The function will be normal, the prevalence is 3.5%, and the patient is not going to have any symptom. Now, stage 2 means there is kidney damage and now the GFR is decreased to 60 to 89. It's a mild CKD and again patient is not going to present, it's asymptomatic. Then we have 3A and 3B, it's 45 to 59. It is mild to moderate and usually asymptomatic. It is the first in the 3B stage. When the GFR falls to 30 to 44, then your patient may present to you with anemia. So anemia in some patients, 3B, it may be non-progressive or progress very slowly. So if a patient presents to you with anemia, you should also go for the kidney function test. Now coming to question number 4, stage number 4, GFR has fallen to 15 to 29. It's a severe CKD. It is the first symptom often at GFR less than 20. So first your kidney symptoms are going to appear when the GFR will fall less than 20. Electrolyte problems are likely to appear as GFR keep on falling. In the stage 5 is when the GFR less than 15 or the patient is on dialysis. So on all the prescriptions of the patient who are on dialysis, you see it is written that CKD stage 5. So CKD stage 5 means the patient is either on dialysis or the GFR has fallen to less than 15. It's a kidney failure. It's a significant symptoms and complications usually present. Dialysis initiation varies, that when you have to do the dialysis, but usually you have to go for dialysis when GFR falls less than 18, less than 10. So what are the key points? Key points are as GFR declines, symptoms and complications increases. Early stages 1 to 3 are often asymptomatic. 3B may present with anemia. Stage 5 is kidney failure. Dialysis or transplant is usually required. So